Current status of the orthopedic pain management. Over 40% of individuals aged 50 and above suffer from joint or spinal pain, representing a tremendous market for orthopedic pain management. This market can be divided into surgical and conservative treatment options. Conservative treatment includes Chinese medicine, acupuncture, massage, chiropractic care, physical therapy, and bracing therapy. Orthopedic surgeons primarily focus on surgical treatments. Influenced by Western education, orthopedic surgeons are trained to prioritize surgical approaches over conservative approaches. Orthopedic surgeons are a branch of surgery. The word of surgeon can also explain why orthopedics training emphasizes surgery research and practicing in surgical techniques. There are significant advantages and disadvantages to undergoing surgery. Advantages: surgery can effectively treat malignant diseases, including tumors, abscesses, and severe fractures. Severe spinal nerve compression should also consider surgical treatment. For example, cauda equina syndrome, drop knee, drop foot. The above situations are extremely rare. It may occupy less than 1% among all patients. Disadvantages: unfortunately, oversurgeries often occur when treating benign conditions, and it will lead to numerous complications and adverse consequences. Therefore, before making the decision to undergo surgery, patients should deeply understand the consequences of the treatment and seek for medical second opinions from others' professional parties. In order to let you understand deeper in surgical treatment, we are going through each common knee and spine surgery and their risks, complications, and adverse consequences individually. Common knee surgeries. A. Treatment for knee osteoarthritis, which means cartilage wear and tear that lead to joint degeneration and deform. 1. Debridement and lavage, to remove osteophytes, uneven cartilage, and clean away the debris in the knee. Disadvantage: after removing osteophytes and the uneven cartilage will easily lead to more serious bone-on-bone friction and accelerate deterioration of the knee. 2. Knee replacement. It divided into partial knee replacement or total knee replacement. This process is to insert an artificial device that mimics the human knee to replace the natural joint. Disadvantages: 1. The procedure requires knee joint opening, and that will increase the risk of infection. Disadvantages: 2. The artificial knee cannot fully integrate with the human bone, leading to loosening or shifting of the implant over time. In most cases, it lasts only 5 to 15 years lifespan. B. Treatment for anterior cruciate ligament tear. ACL reconstruction involves taking a portion of tendon from the hamstring or patellar tendon and using surgical screws to fix in the knee to replaces the torn ACL. Disadvantages: over time, the tendon without blood supply and metabolism will degenerate and lose elasticity. It will be dying gradually, typically lasting only about 3 years. C. Treatment for meniscal tear. Arthroscopic meniscal surgery involves trimming off the torn portion of the meniscus. Disadvantage: removing part of the meniscus, the knee will lack of cartilage protection, increasing the risk of bone-on-bone friction and leading to osteoarthritis and eventually worsening knee pain. Meniscal repair involves stitching the torn meniscus. Disadvantages: 1. The stitching technique is very complex and difficult. Thus, there is a high failure rate. Disadvantages: 2. The stitch may strangulate the blood vessel of the meniscus. It makes recovery become difficult. Disadvantages: 3. Continuously weight-bearing activities will make meniscus re-tearing. Common lumbar spine surgeries. For treating herniated discs. A. Endoscopic discectomy. This procedure involves creating an opening with a rongeur to remove a small section of the lamina and yellow ligament, which provides access to remove the herniated disc, thereby relieving pressure on the compressed nerve root. Excessive removal of disc may lead to vertebral collapse. Insufficient removal of disc may cause recurrent disc herniation, leading recurrent spinal nerve root compression. If excessive damage occurs to the lamina, yellow ligaments, and surrounding tissues during the opening process, it may result in vertebral instability and lead to nerve impingement. For treatment of vertebral instability and nerve impingement is spinal fusion. It is classified into 1. Anterior spinal fusion. Disadvantages: adjacent segment disease. It is very often occurring where spinal joints near the fused area degenerate more quickly due to increased stress. This can potentially impact daily activities, such as bending. 2. Posterior spinal fusion involves putting pedicle screws to fix the vertebral bodies in the back. Disadvantages. 1. The pedicle screw cannot fully integrate with the human bone, leading to loosening or shifting of the implant over time. Disadvantages. 2. Pedicle screw misplacement can potentially damage the nerve root and surrounding blood vessels. C. Artificial disc replacement involves inserting an artificial disc that mimics the human intervertebral disc to replace the damaged one. Disadvantage. Over time, the artificial disc may not fully integrate with the bone, leading to loosening or migration. It will cause recurrent nerve root compression simultaneously. Besides surgery, orthopedic surgeon commonly offers injection or oral painkiller as treatment. Common knee injections usually include hyaluronic acid and steroids. 1. Hyaluronic acid. It only provides temporary lubrication and pain relief, but it will gradually be absorbed and loses its effectiveness over time. 2. Steroids injection. Disadvantage. Could providing short-term relief from inflammation, but for long-term usage may accelerate joint damage and worsen osteoarthritis. 3. Oral painkillers. Disadvantage. Long-term use of painkillers can increase the burden on the stomach and kidneys, ultimately leading to kidney failure or gastric ulcers. In a nutshell, orthopedic surgery may destroy the natural structure and surrounding tissues, leading to joint locomotion imbalance. According to public source, over 99% of benign disease can be improved through conservative treatment. However, the current conservative treatment in the market includes Chinese medicine, acupuncture, massage, chiropractic care, and physical therapy, cannot precisely tackle the root cause of the pain. Some of them do not provide long-term pain relief. Some of them may have side effect, as the problem of we mentioned above, due to many oversurgery of benign orthopedic diseases done by surgeons, causing complications and adverse consequence. Due to low potency and some side effect treated by others conservative therapy. In response to these challenges, we have invented and developed a series of portable therapy for benign orthopedic diseases. They are effective and precise engineering solution to tackle the root cause of pain. For example, sciatica treatment. Sciatica is often caused by nerve root compression due to conditions such as herniated discs, spondylolisthesis, and lumbar scoliosis. This compression can lead to pain or numbness that radiates along the sciatic nerve pathway. Using our device can create dynamic traction by applying a detraction force on the rib and pelvis, effectively lifting up the vertebral body. This process can significantly decompress the herniated discs and release nerve compression, thereby alleviating sciatica pain. Knee orthoarthritis treatment. OA knee caused by bone-on-bone friction that leading to knee osteoarthritis with collapse, instability, and loading pain. With our product, utilizing a 3-point leverage system to open the medial gap. This approach can effectively reduce deformity, eliminate instability, and relieve loading pain. These two products have successfully served over 5,000 patients, with 98% satisfaction rate. This is because our brace therapy offers the most targeted and precise mechanical treatment available. In conclusion, the therapeutic braces have no side effects and are effective, compliant, economic, portable, and can be applied anywhere, anytime. Therefore, 99% of benign orthopedic diseases can be improved by brace therapy. This treatment is a priority option to avoid surgical complications and adverse consequences. Interested parties, please contact and partner with us for mutual growth and success.